So Roberto Baldizon is going to present Silibrain.
Hey guys, thank you for having me. Hi Tori, we met before because I participated in FI for some time. I'll be sharing my screen. Let me know if you can see if you can see the slides. Okay. So Silibrain. Well, let's start with my name. My name is Roberto Baldizon. I'm originally from Guatemala, and I'm the founder of Silibrain. So Silibrain has been a company developing software solutions for startups and small clinics and small businesses for a couple of years, as well as doing technology consulting, specifically focused in radiological equipment, which we have helped install in remote locations. So some of the things that we have done in the past, as described, have been mostly based on the agency part of it and the consulting part of it, which is what right now still generates most of the revenues. But with our team, we have been the opportunity to collaborate with others, interesting researchers and universities. So in 2018, we actually developed a patient-managed EHR, which was selected among the top 50 in the world. That's me presenting it in Germany. We keep developing it with universities such as USC, U of Toronto, with whom we have students that come in and keep on building it through the semester. And we have the opportunity to then, through our group of advisors and experts, we keep on doing research and developing solutions, such as what we did for the pandemic, in which we had the opportunity to develop CODI, which was patient engagement solution that, utilizing big data, was able to enhance the accuracy of lateral flow assays, specifically antibody testing, for COVID from a baseline of 70% to 86%. So the way we did it is with utilizing large amounts of data that we were able to acquire. We use contextual evidence to add that to the test. So even though the test itself might say 95% specificity, the reality of that is that the actual accuracy for diagnosis is way less. But when adding contextual evidence, we were able to increase it. And this project is the one that started out with Vivestock. That's the project that I'll be talking to you about today. And that's the main one that we're driving for. Why we built this with the researchers was because, well, during the pandemic, we actually were consulting some clinics, and they having the issue of patients coming in with a positive PCR test and actually then not developing the disease. Yes, you could argue that perhaps they were asymptomatic, but given the amount of them and the probability of the situation, it was more likely that it was a false test due to ill-managed samples. The same was true for the opposite. We would have patients come in. They would have patients come in with all the symptoms of COVID, even though they had PCRs that were negative, and they kept doing it and getting negative results. With some clinics that had advanced radiological equipment that we helped, they were able to do CT scans and manage it that way. But a lot of others were not, for which tools like CODI, which is now Vivestock, were actually of great help, since they were able to increase the accuracy of that diagnosis. It still happens for other diseases beyond COVID. About 25% of patients are misdiagnosed the first time. Some take more than 5 years to get an accurate diagnosis of what they might be going through. And this is true even today when we can correlate that data to more than 80% of diseases. Some minorities or ethnic groups are more prone to that, such as the Hispanic community in the US, as well as the rest of the Americas, which tend to have poorer health outcomes. Given the survey data that has been collected, it seems that most Hispanics believe that that's because of their line of work, as well as poor access to healthcare. So the poor access means either because of the geographic location where they're located, or cultural barriers, as well as linguistics, in which a lot of those patients don't feel as comfortable communicating to practitioners because of the perceived cultural difference or just linguistic barrier that there is. And that's something that calls our attention, as there is already 62 million Hispanics in the US, which represents about 1 in every 5 people. For this reason, we believe that Livestock has a great opportunity as an inclusive chatbot for patient engagement to be able to increase adherence and make it a little bit more friendly for this type of patients initially, for this community, to be able to keep on communicating with their practitioners and then find a new practitioner if they're having specific issues. So the way we have building it currently is that for, say, example, diabetes clinic can add, following our pre-built model, a use case for a patient which can check for their BMI, and then if their BMI is above a certain level, then they can find out a little bit more about the FAQs and check if they might be needing to get further testing, such as the risk of associated with a higher BMI, such as hypertension, diabetes type 2, as well as other diseases. At this time, mostly we have been focusing on rapid testing. So that would be diseases that already have that are contagious, as well as the ones of neurological development and the ones associated with obesity, such as diabetes and hypertension, mostly because of the contacts that we have and the clinics that we have been working with. So this is an example of how the patient bot can redirect, the chatbot can redirect the patient that is concerned about their BMI and the potential risk that they can have, about just further information on how much more risky it is for them to develop diabetes type 2 given their BMI, and then get further testing for that. And if not, if their BMI seems to be normal, then that doesn't mean that they're at lesser risk necessarily of developing a certain disease, but we can provide that information to the clinician, so it speeds up the process a little bit more. That type of conversation would be available both in Spanish and English. So for the clinic, they would be able to see a conversation and then assign it to a specific person if they have more people in the clinic that support them with such engagements. We believe that this is continuously growing in importance as populations keep aging, and the number of physicians per 1,000 inhabitants don't grow at the same speed, for which we think that such solutions regarding patient engagement will be of continuously higher importance. There are other companies which have already made big strides or they have already entered the market and are causing a big impact, such as ZocDoc, which enables people to schedule appointments with physicians. WebMD, we also keep adding that here, as it might not be directly a patient engagement, but a lot of people do use it just to find symptoms and then actually take action based on whatever symptoms they can find. And Patient Pub, which enables people to enables clinics to better communicate with their patients. We believe that Livestock can be a great addition to that ecosystem to keep on adding demand for specific physicians that may not be as known, to lower patient anxiety regarding their symptoms and get them treated properly if they need to, as well as eventually through collaboration allow them to sign up for potential clinical research opportunities that they might have, as well as described, allow them to find the practitioners that can help them best and increase such referrals. So we have already qualified that market. We are already running pilot tests with some small clinics and hospitals, mainly in Central America, where we have great connections, as well as started talking with EHR companies such as Athena Health. At this stage, we're currently keeping on developing Livestock and seeking more pilot opportunities so that we can improve it and make it better for each practice, not just a solution that has been developed for that diseases, which we already have some data. So if you find this interesting, or you know someone that might find it interesting, to let us know, shoot us an email, and we'd be glad to collaborate. So that's about it. Thank you for your time.
Roberto, thank you for that. And by the way, you nailed the time very, very accurately. So thank you for that as well. I will say that if I was to describe what I just saw to someone else, I would say this kind of looks like an old school chat bot applied to, some health. What effect has ChatGPT had on your team in the last month or so?
Yeah, solutions like ChatGPT, as well as others that were already available through Google or AWS, had made it way easier to develop AI that can be integrated to such a chatbot, so that utilizing even just contextual evidence, such as the geographic location where that person is, and the incidence of disease in that area, as well as some symptoms that they might be going through, then you could potentially even generate a diagnosis. We don't like calling it like that because I know there's a lot of legal implications related to that, but it can be used to build a chatbot that can be better, that can be better used to make the patient flow a little bit easier. So it's not the reason. It's a little bit hard of a topic, because when the way we look at it, and as technologists, we love seeing it as a clinician aid tool that even can help in diagnosis. But when we discuss it with practitioners, such as the ones in this audience, we actually like using it more and we see it more and applicable in the field as a tool that can help people better understand the symptoms, and engage with a model that might be a little abstract in a way that's more humanly possible. I don't know if I actually answered your question. Sorry, I just started talking.
Thank you.
I have a question. Maybe you can help me connect the dots a little bit. So I feel like Silibrain's like the parent company. You guys are an app development firm focused on certain areas of healthcare. And then this is a product that you've created. Is this product, was it created for a customer? Or was just a need that you saw in the marketplace? I'm trying to see if there was like a paying customer behind this, and how are you working to scale it for them? I'm just trying to connect the dots here.
Yeah, so it was developed for a paying customer. The hospital for which we developed an EHR solution. So for them, they actually had, and a lot of clinicians in Latin America, as well as the ones that we have met in the US for Hispanic communities, they needed a tool which they could actually communicate with their patients in a better way, and which could enable them to streamline the process. There are solutions such as the Epic has already launched MyChart, which is great at doing that. But it's not as applicable for all communities, specifically if it's not well culturally addressed to them. The initial need, what we were asked to build was something very similar to as Tori said, the old chat bots that exist, but just applied to medicine. So that's what we started with, and then we added the pre-built solutions that we were able to develop using research and then things such as ChatGPT.
So do they own this product, or do you own it? And you have rights to license it, or?
Correct. No, we own it.
Okay.
We just built it following their requirements.
Got it. And then my last question, and it's just, again, just trying to connect the dots a little bit. I'm trying to figure out what that key differentiator is with you guys versus maybe other app development firms. And I did take a quick look at your website, and it looks like you're really focused on kind of like, I think it says something about like developing apps for good, like that kind of thing. So why is just curious, as your model's set up as you're structured as an LLC, why not a public benefit corporation or nonprofit or something like that? Or what's the key differentiator here? That's what I'm trying to understand.
Yeah. So I would say the key differentiator is mainly that we focus on tropicalizing solutions. But right now, that would be for Silibrain, but the discussing it for Pipestock, I would say it's mostly that this project is a different pilot project that we started out from a specific request from a client. And then by talking to other clients, we found that there was a greater need in the market for that, which we keep developing following such feedback.
Right, makes sense. Great work. Thank you so much.
Thanks. Yeah.
And any questions or move on?
Yeah, just to clarify, is this more of a patient education and engagement tool? Is it a way to help doctors sort of figure out the diagnosis? I'm a little bit confused in terms of what exactly the product is accomplishing.
Yeah, it's more of a patient education and engagement tool. For some clinicians, general clinicians that may be starting out, then it could actually be used to enhance their diagnosis, but it's not the main goal of that.
Okay, thank you. Thank you, Roberto.